Welcome to Explain, a series of health education programs published by the Patient Education Institute, the leading provider of interactive health education. This video includes general medical information and does not replace the medical advice of your doctor or healthcare provider. If you have questions pertaining to your medical condition, ask your doctor or healthcare provider. Release of Tethered Cord. Introduction. Tethered cord syndrome is a condition that can be found in children or adults. If not treated, this condition could lead to severe symptoms that may include paralysis and bowel or sexual problems. Your doctor may recommend surgery to correct this condition. The decision whether or not to have this surgery is yours. This patient education module will help you understand the condition as well as the benefits and risks of this surgery. Anatomy. The spinal cord connects the brain to the rest of the body. It allows the brain to send messages and orders to the body. It also allows sensations and other information to travel from the body to the brain. This is how the spine looks if you cut it across the middle. It is known as a cross-section view. This is where the spinal cord is located in the vertebrae. Nerves connect the spinal cord to the rest of the body. The spinal cord and nerves are surrounded by fluid called cerebrospinal fluid, or CSF. That fluid acts as a shock absorber. The spinal cord, nerves, and CSF are covered by a covering known as dura. This covering prevents the leakage of any CSF to the outside. The spine protects the spinal cord and parts of the nerves. The spine is formed by strong bony structures called vertebrae. The vertebrae are separated by softer discs. The spine is composed of 4 sections. First, the cervical spine or neck, which consists of 7 vertebrae. Second, the thoracic spine, or the middle part of the back, which consists of 12 vertebrae. Third, the lumbar spine, or the lower back, which consists of 5 vertebrae. The fourth part is the tailbone, which is composed of multiple vertebrae that are fused together. The vertebrae are numbered from top to bottom. For instance, the first vertebra of the neck is known as C1. C stands for cervical, and 1 stands for first vertebra. The lowest vertebra in the thoracic spine is known as T12. T for thoracic spine, and 12 is its number. The second vertebra in the lumbar spine is known as L2. Again, L is for lumbar, and 2 is the number of the vertebra. In the spinal cord usually ends at the L2 level. The part of the spine that is lower than L2 usually contains nerves only. The tip of the spinal cord is connected to the lowermost part of the spine by a strand of tissue known as the filum terminale. This tissue is like a ligament. Symptoms and their causes. Sometimes, however, the end of the spinal cord is located at a level lower than L2. This is known as a tethered spinal cord. This causes stretching of the spinal cord. This stretching could lead to weakness of the legs, bladder, bowel, and sexual problems, leg and feet deformities, or numbness in the legs. These can be discovered early in life in children. Tethered cords usually occur shortly after birth. However, sometimes signs of this disease do not show up until adulthood. Nobody knows why these signs and symptoms are delayed. The stretching or tethering could be associated with a thick filum terminale. Sometimes the tethering occurs with a non-malignant fatty tumor. The tumor may involve the filum terminale alone or can include parts of the spinal cord and nerves. In some patients, obvious signs in the lower back can lead the physician to suspect that the spinal cord may be tethered. These signs could include a dimple in the skin, a patch of hair, or some abnormal blood vessels at the level of the skin. This condition is best diagnosed using an MRI that can show the exact location at the end of the spinal cord. This MRI shows a tethered cord with fatty tumor. The fatty tumor is also known as lipoma. The top arrow, the green one, points to where the spinal cord usually ends, at the L2 level. The middle arrow, the red one, points to where the tethered cord ends. The bottom arrow, the blue one, points to the fatty tumor.
Sponsored by the Patient Education Institute. www.patient-education.com. Over 5,000 videos and interactive tutorials.
Alternative treatments. When the doctor determines that the spinal cord is stretched, it is best to treat the tethered cord surgically. This prevents future permanent injuries. This also prevents future weakness in the bowel and bladder and sexual dysfunction. Some of the symptoms present at the time of diagnosis may not improve despite the operation. The main aim of the operation is the prevention of further problems. That is why it is preferable not to delay the operation. Procedure. Tethered cord operations are done under general anesthesia. The lowest part of the spinal cord is approached from the back. After the hair of the back is clipped, an incision is made near the site of the lowest part of the spinal cord. The incision also includes the site of the tumor, if any exists. The incision is then taken down to the bones of the spine. The muscles are separated from the bones and enough bone is taken out to expose the dura, the covering of the spinal cord, and its fluid. The dura is then opened up and the spinal cord and the nerves are seen. If any tumor exists, it is then removed. A microscope may be used to help the surgeon see and take out the tumor. Using his or her judgment, the surgeon will take out as much of the tumor as is deemed safe. Some tumor may be left behind if the surgeon determines that removing it will result in spinal cord damage. The filum terminale is also identified and cut to untether the spinal cord. After this cut, the end of the spinal cord may rise to a slightly higher level. However, it is not expected to regain a totally normal level. MRIs done after the operation may show that the end of the spinal cord has not changed its location. This is normal and expected. In most cases, the dura is closed. After closing the dura, the muscle layers and skin are also closed with special sutures. The bone that is taken out does not usually need to be replaced. Risks and complications. The surgery is relatively safe. There are, however, several possible risks and complications. These are unlikely but possible. You need to know about them just in case they happen. By being informed, you may be able to help your doctor detect complications early. The risks and complications include those related to anesthesia and those related to any type of surgery. Risks of general anesthesia include nausea, vomiting, urinary retention, cut lips, chipped teeth, sore throat, and headache. More serious risks of general anesthesia include heart attack, stroke, and pneumonia. Your anesthesiologist will discuss these risks with you and ask you if you are allergic to certain medications. Blood clots in the legs can occur due to inactivity during and after the surgery. These usually show up a few days after surgery. They cause the leg to swell and hurt. Blood clots can become dislodged from the leg and go to the lungs, where they will cause shortness of breath, chest pain, and possibly death. It is extremely important to let your doctors know if any of these symptoms occur. Sometimes the shortness of breath can happen without warning. Getting out of bed shortly after surgery may help decrease the risk of blood clots in the legs. Some of the risks are seen in any type of surgery. These include 1. Infection, deep or at the skin level. Deep infections may involve the spinal cord or the fluid that circulates around the spinal cord and brain. This is known as meningitis. Treating deep infections may require long-term antibiotics and possibly another operation. 2. Bleeding, either during or after the operation. This may necessitate, in extremely rare cases, a blood transfusion and the possibility of another operation to remove blood clots. 3. Skin scars. Other risks and complications are related specifically to tethered cord surgery. These are also very rare, however, it is important to know about them. Depending on the site of the operation, the legs may become paralyzed, bowel and bladder control may be lost, and sexual function may be affected. The risk of paralysis is rare. The size of the tumor, the severity of the tethering, and the severity of the problems before the operation increase the risks of paralysis. CSF, the fluid that bathes the spinal cord, may leak through the dura, under the skin, and even to the outside. Another operation may be needed to repair this fluid leak. CSF leak can also cause headache, nausea, and vomiting every time the patient sits up and elevates his or her head. Be sure to tell your doctor if you notice these signs after the operation. After the operation. After the operation, you may be asked to lie flat for a few days to allow the dura covering the spinal cord to heal properly and prevent fluid leaks from around the spine. The nurses will check the function of your arms and legs repeatedly to make sure you are recovering and not getting worse. Heavy lifting, bending, or twisting is usually not allowed in the first few weeks after surgery. Physical therapy may be needed after the operation to help you strengthen your muscles. Depending on how much physical therapy is needed after the operation, patients may stay in the hospital or in an extended care facility from a few days to a few weeks. It may take a long time to recover from the weakness and symptoms that were present before the operation or that have occurred since. It is therefore very important for patients to follow a strict physical therapy program to help them become stronger. You should make sure to call your doctor if you develop any severe headache, fever, new weakness, or fluid leak from the incision. All these may be signs of serious complications.
If you like this video, please like and share. For similar videos, subscribe to our channel.
Summary. Tethered cord syndrome is a condition that could cause dangerous bladder problems and lower extremity weakness if not treated quickly. An operation to untether the cord is usually successful in preventing more severe symptoms. An operation may even help in improving some of the symptoms. This operation is relatively safe. Risks and complications are not frequent. Knowing about them will help you detect and treat them early if they happen. Thank you for using Explain.